What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for April 26, 2021. COVID-19 vaccines and people with disabilities. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Maria Town, President and CEO of the American Association of People with Disabilities, about the many unique challenges faced by the disability community during the COVID-19 pandemic. Let's listen.
Maria Town, thanks so much for joining me.
Thank you for having me. I'm delighted to be here.
So you are the president and CEO of the American Association of People with Disabilities. And I'd love it if you could just tell our listeners a little about your organization.
That's right. So the American Association of People with Disabilities, or AAPD, is a national cross-disability civil rights organization that works to build the economic and political power of the disability community across the country. Very importantly, AAPD is a disability-led organization. So often, organizations that work on disability are not led by disabled people themselves. I am disabled, our staff are people with disabilities, our board is majority people with disabilities. And I want to highlight, too, that we're a cross-disability organization, meaning that we do not focus on a specific diagnosis or a specific experience of disability. The disability community in the United States is 61 million people strong. And so when we talk about disability, we mean everything from premature babies who are going to grow up to become kids with developmental disabilities like me, or adults with developmental disabilities, to older adults who may not even identify as having a disability, but they definitely experience it. They might say things like, I don't hear as well as I used to, or I can't get around as well as I used to. That's disability too.
Terrific. I want to talk today, obviously, about COVID. And I know that COVID has been an opportunity, unfortunately, to really exacerbate some of the disability issues. I want to talk about vaccines because I think that's top of mind for everybody these days. What are some of the issues that disabled folks are having when it comes to accessing vaccines?
Well, there are quite a few. One issue that's gotten a good bit of attention, but unfortunately not a lot of action, has been the issue of prioritization, vaccine prioritization. So people with disabilities have been impacted by COVID in every way imaginable. First, we know that at least 40% of all COVID deaths have been people with disabilities in congregate settings and long-term care facilities. There are people with disabilities across the country who have literally not left their homes in more than a year because they understand that they're at very high risk for COVID. But unfortunately, because their conditions are rare or because their disabilities are rare, there's not data to show their risk. And in part because of this, people with disabilities living in the community have not been prioritized for the vaccine. And you would think it would be quite the opposite, right? Folks who are at the highest risk would get prioritized. And we've seen some of that with the prioritization of long-term care facilities, but people with disabilities living in the community haven't been able to get access to the vaccine. We're seeing that begin to shift. Initially, we actually saw the shift going quite an opposite way. We saw states like California, Texas, Nevada, and others continue to deprioritize people with disabilities. And now that, the administration is committing to, the Biden administration, I should say, is committing to making every adult over 18 eligible by April 19th, we're beginning to see those prioritization issues not matter as much. But even with that, people with disabilities are still experiencing major issues to getting a vaccine appointment because of inaccessible vaccine appointment websites, especially at the beginning of the vaccine rollout when you had to have lightning fast mousing and computer skills in order to to get your vaccine. That's an accessibility issue for many disabled people who may be using assistive technology to navigate those websites. Maybe they have, maybe they use a different mouse. Maybe they don't move as quickly because of their fine motor skills, all kinds of things like that. There are many people with disabilities for whom it is still not safe to even go to a vaccine appointment. We're beginning to see some vaccination programs that will go into people's homes, but those are happening really only in the past few weeks, and they are few and far between. Other barriers to the vaccine, these mass vaccination sites, you either have to have a car or you have to be able to navigate a lot of crowds. Many people with disabilities don't drive. We experience significant barriers to transportation, or it is an access issue for us to navigate these large crowds and large lines. So there are plenty of barriers. I want to be clear, I'm really hopeful about what's to come with the vaccine, especially with this new promise. But the promise of more vaccine availability does not resolve all of these issues, particularly for the disability community. If we are not making sure that these vaccine websites and physical vaccination sites are accessible to people with disabilities, if we're not making sure that the communication about the vaccine is accessible and is available in a variety of formats, we are still going to see a major gap in people with disabilities' access to the vaccine itself.
And I know you're concerned about these so-called vaccine passports we're hearing something about.
Yes.
I know people are worried that they're going to be asked to provide proof that they've been vaccinated. Tell me your concerns.
Yeah. So I think in many ways, a vaccine passport, makes sense. If industries or states or communities wanted to establish some kind of guidance that folks had to be vaccinated in order to travel on a plane or go to a park, there's a logic there that I can see. At the same time, because the vaccination process has been so inequitable, the vaccine verification process will not only repeat, but amplify those inequities that we've seen within the vaccine rollout. Also, current proposals around vaccine passports do not acknowledge the diversity of ways that people have received their vaccine. So again, thankfully, many states prioritized individuals in congregate settings and long-term care facilities to get the vaccine. Right now, the proposal is that where you get your vaccine, you're also going to get your verification. If you received your vaccine in a nursing home or in a group home, and many people, unfortunately, don't have access to their own records when they're in these facilities, how are they going to get their vaccine verification? For immigrants and immigrants with disabilities who may have received their vaccine in a detention center, how are they going to hold on to and have autonomy around their vaccine passport? How are we ensuring that the vaccine verification system is not tied into an immigration system or a justice system that might penalize folks who are already having to navigate our nation with significant fear of deportation or recriminalization? One of my concerns is that having a vaccine verification process in place may actually increase vaccine hesitancy in many of the communities who are already experiencing major disparities around COVID itself, right? So communities of color, people with disabilities who have seen so much death in the past year. We need to be doing everything we can to remove barriers to the vaccine and increase vaccine confidence. And I don't want vaccine verification to complicate that.
I can see that. I know that the disability community, it lives on this bedrock of interdependence, that you need other people to help you to navigate the world.
Yeah.
This has probably been really challenging during this time of social distancing and staying home. Could you talk to me a little bit about what COVID has meant to many groups like this?
Absolutely. And I want to be clear, the disability community is very forward with our relationship to interdependence. But I think one of the things that we consistently try to point out is that everyone is interdependent, that our idea of independence is totally like a false hope there. It doesn't exist, right? It's a unicorn. And for people with disabilities, we are very aware of our interdependence. For example, for individuals who work with direct support professionals and home care attendants, who may need assistance getting dressed, getting out of bed in the morning, eating, accomplishing specific tasks if they have executive functioning disabilities. It has been incredibly difficult for people to access these necessary services and supports for a variety of reasons. One is that this workforce, this direct support workforce, was not prioritized as a part of the healthcare workforce. And so they were often ineligible for things like personal protective equipment or the vaccine. Also, this workforce is predominantly composed of women of color who have, again, experienced COVID at alarmingly high rates. Things like social distancing restrictions, travel restrictions that occurred in localities also prevented people from traveling across a city or across a county in order to connect with the folks that they need to survive. So that's one example. I think another example that we see quite often is individuals who are blind or individuals who are deaf. A lot of these folks who experience significant barriers to information as it's typically presented. So say you're going grocery shopping, or you need to get your car fixed and to communicate with someone. Getting assistance at the grocery store when you're blind or low vision, it's not possible to do from 6 feet away. If you are deaf and you need to have access to a sign language interpreter who literally needs a clear line of vision to see you, that's another person who gets involved, and it can be really difficult to social distance and enact that interdependence. So a lot of people have felt incredibly isolated, even more so than all of us have felt. And I know that you want to also talk about telehealth, and I think the telehealth platforms are one way that we also see interdependence being difficult. I'll use myself as an example. When I go to the doctor, I often like to bring a friend. Why? Doctor's appointments can be intimidating. Doctor's appointments can be scary. If I'm already feeling bad, I may not be the best person to absorb all of the information that a doctor is telling me, either about my body or a course of treatment or a course of action otherwise. So I like to bring a friend. That can be true for telehealth too. But often telehealth only allows a one-to-one point of communication, right? If this were a telehealth appointment, you, Stephanie, might be my doctor. If I'm the patient or the healthcare consumer, I couldn't also send the link to a trusted friend or ally to be an additional set of eyes and ears in that appointment and make sure that I am understanding everything that's being said. It's little things like that have really gotten very difficult. And so when we think about telehealth, and one of the things that many people are talking about as a kind of silver lining for the disability community, that's true. Expansion of telehealth has been great, and it removes a lot of barriers to in-person healthcare management, but it also creates some new ones, and it does make it harder to have things like interdependence in doctor's appointments.
Do you think that we have learned things from this pandemic that we will be able to use going forward to make things easier for those who are disabled?
I hope so. It is, if we haven't, what's it going to take? I really hope so. And is 500,000 lives not enough? And one of the things that we've seen is that COVID has necessitated new kinds of access or different kinds of access for everyone. And it's been a frustrating experience as a disability advocate because we've been asking for things like telework for decades, right? We've been asking for more accessible grocery delivery apps for a while. And now that, non-disabled people need all of these things, they're happening. And so that's been frustrating. But I want to be clear, I hope that telehealth, the availability of telehealth, the availability of telework, the way that we're thinking about public health measures, while COVID has been awful, right? And nothing I could say could communicate how terrible it's been. The deaths that we had this season related to the flu were vastly diminished. And I think that's one way of us looking at, these public health interventions like masking, very, very regular hand washing, use of hand sanitizer and social distancing that works. And people who are immunocompromised will continue to exist beyond COVID. And so I hope that people, individuals and communities continue to really push things like hand washing, masking, social distancing in community gatherings and in the workplace as a form of respect and kindness for the many kinds of people and immune systems and disabilities that exist in this world and will continue to persist past COVID.
Maria Town, thank you so much for your time.
Yeah.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.